Hello, everybody. Thanks for coming back to listen to more of the program. My guest for this episode is Sammie Mcfarland. Sammie is the founder of Long COVID Kids, which is located in the United Kingdom. And Long COVID Kids is an advocacy group and a support network for children and their families having to deal with long COVID. And please hunt down their website, longcovidkids.org, for more information on their work and what they're doing and what they can offer. We had a very interesting chat, and I hope you enjoy. Cheers, guys. All right. Well, thanks for coming on, Sammie. You're actually the first guest I've had on from the UK, and the vaccine rollout has been taken off there pretty fast. Can you go over what the situation in the UK is like now?
So at the moment, we are just about to start vaccinating the under 40s, and there's been a good vaccine uptake so far. We are informed, and we don't currently have vaccines for children. So that's something that they're trialing at the moment.
Oh, okay. Can you go over for us your organization and what you've been doing over the past year or so, and how you got started and got into that?
Of course. So Long COVID Kids started back in the autumn. My daughter and I both got COVID in March 2020. And by May, we still weren't getting better, and saw a doctor. And I had a situation where I went to the surgery for a blood test and saw a nurse. It was the first time I'd seen another human being since I'd got ill back in the March. And she asked me how I was feeling, and I burst into tears and just said, I'm fed up, not getting better. And she said, "Oh, I think you're depressed." And I sat there thinking, well, I don't think I'm depressed. I think I'm fed up being ill. And you're the first person that I've seen in months. And so I reasoned with her that I had a child who was also not getting better and had similar symptoms to me, but not identical. And she said, "Oh, I think your child's mimicking your symptoms. I think that it's just due to lockdown. And once she sees her friends again, she'll be fine." And I came away feeling so shocked and angry, and also responsible that my child wasn't feeling better. And I pretty much just stayed in bed, didn't talk to anyone, and slept and cried for about 3 days. And then I woke up after that thinking there must be other people like us who are in the same situation. We can't be the only people not getting better from COVID. And as a family, we're very much into health and well-being. I work in the well-being industry. So, we were being as proactive as we possibly could be. So I then got on the internet and found the adult long COVID support group, and through that group reached out to meet some other parents. And there were about 7 other parents who said, "Yeah, I've got a child or children that aren't getting better." And I was getting more and more frustrated with the response we were getting from GPs, from people actually just generally in society saying, "Well, you can't still think it's to do with COVID. You're only going to be ill for a couple of weeks and then you'll get better." And so I encouraged the other parents to help me make an awareness video, and that video went onto YouTube. And then from there, the floodgates opened, and many, many families came forward. And we set up a Facebook group so that there were somewhere for all the families to connect. And very quickly that became so busy that we had to set up a website to try and divert inquiries to the website, and to really start highlighting what we're going through as long haulers with children with long COVID as well.
So how many GPs did you go see initially to get different opinions on?
So just one, because we only had one appointment because we were ill at the point in the pandemic where you just couldn't get an appointment unless you were not able to breathe. They didn't want you at the hospital. We were told, in fact, we had to call 111 at one point, and my daughter was weak and floppy and unresponsive. And we were told, is she breathing? Asked, is she breathing? Okay. And we were like, yeah, her breathing's fine. They were like, well, you stay at home, manage her condition at home, which was terrifying. And so when it came to trying to get any kind of support from the doctors, again, they had to do a full COVID risk assessment before they would see you. We had to come out into the garden to be seen. And I wasn't at that point able to get out of bed, but they needed me to come down and be out in the garden to assess me. So going through that process was challenging, and obviously there's only so many people that they can see when they have to go to such extent for the amount of patients. So we only got seen once in 7 months, although we were emailing and speaking to on telephone appointment about our situation. That generally, as long as you could breathe, that was kind of the baseline of where it's at. And because they don't have any understanding of what long COVID is, or at that point didn't even have it wasn't even called long COVID, they didn't really, there was nothing they could do. So it was extremely frustrating, difficult time, and it left us, I realize now actually how isolated and how harrowing it was. And at the time we were just getting on with it because that's all there was to do. But it's had a much greater effect than we realized at the time.
Were you surprised that your doctor was just trying to, find some other not really related reason as to what was causing your ailment? Like, or maybe it's just depression or something, instead of trying to look in further. And, did you see anything else, maybe in the press or anecdotally, of people having this at that time?
No. So at the time that we were ill, I didn't know anyone else personally. I did when I joined the adult support group, there were 5,000 other people in it. Now there are 36 or 37,000, and I just didn't know anyone. I didn't even know anyone who had COVID. So I didn't have any sort of anything to reference it against. And I didn't really feel too frustrated at the doctors at that time, because it's so new, and they obviously doesn't you can't expect them to know anything. But as time has gone on, I have got more frustrated about the way that our care has been, because I feel very strongly that they may not know how to treat us, but they could still monitor. And I think that, I feel like we should be getting a call to say, are you still ill? How are you feeling? How are your symptoms? Because there are, as we learn about long COVID, we're learning that there are lots of things that can be managed, and lots of symptoms that can be treated, even if not cured. And yet it's almost like unless you're knocking on the door, you don't really get a look in terms of care. And there's only so many times you feel you can say the same thing. If you're saying, well, I've got chest pain, unless it kind of fits the bracket where they think you need to be admitted immediately because you're having a heart attack or similar, it's kind of like, well, you had that last month, or and it's like, well, yeah, but I've still got it this month and I'm not feeling any better yet. And it's and I've had to change my life dramatically because of it. So I don't hold a grudge. I'm not angry, and I'm increasingly frustrated and disappointed. But at the beginning, I had absolute deep respect for the medical staff trying to do everything they could do and just firefight with the situation of people in hospital. That's obviously the priority of keeping everyone alive. But like now, we know that long COVID is so prevalent. I really wish that there was better care.
What are some of the treatments available?
So just in terms of managing specific symptoms, so not actually treating long COVID, because obviously we don't know how to treat that yet. There are lots of hypotheses, and there's lots of discussion about things which have helped certain people, but nothing that's been evidenced yet that I'm aware of anyway. So one of the things that works really well with the children is really simple things like electrolytes, and magnesium, so Epsom salt baths, those kind of things, which are, you need magnesium for sort of every cellular function in your body. So interestingly, a lot of the families that have had private tests, and stool, urine, or hair tests have found that their children are deficient in similar things. And if you talk to, as we do, many families that are interested in health, and they say, but we have a good diet, and we've been doing supplements. So the question then could be, well, is it to do with absorption that's the issue? And so the families which have been working on gut health, microbiome, the gut health, they definitely have seen improvements in their children. But we can't say for sure that it's that. Could it be just time and coincidence? Could it be something else? We don't know. But certainly that's something that, lots of the families talk about as having a positive effect on recovery.
Interesting. Yeah, and I haven't heard of anything until now of it, of any tie-in with gut health or anything like that, that it's having a negative effect on people that way.
Yeah, there are a couple of really good studies, published research papers on microbiome, COVID and microbiome gut health, and one naturopath that we have been working with, that we actually see ourselves, has been looking after long haulers since really this time last year, and so she's now had a large number of clients, obviously private clients, because over here we have the NHS. So, most people don't pay privately for additional tests because there's kind of a general expectation that the NHS will give us everything we need. And of course that can't happen, but it is unfortunately a historic expectation. So the people that have paid privately for the additional tests, she's tested so many people that she felt that she could give us a presentation to our group, because she's seen so many similarities in so many of the cases, that she felt comfortable in giving a presentation and making some generalized recommendations that people could start implementing to try and improve their health, even if they couldn't afford to access the tests, which has been really helpful. And a lot of families have found that really beneficial. And she's particularly been interested in studying the gut health. So, and it is something that I've been very interested in for many years, working in health and well-being, and it's something I'm very proactively recommending to clients when I'm in my usual work. So, I do think that there seems to be something about COVID that potentially prohibits the absorption, which maybe goes on to create longer term lasting issues with recovery. Or is it that they had deficiencies in the first place and that's why they ended up, we don't know. So that's why we need the research.
It's really getting freakier as time keeps going on. Like, as the more I hear about this, the more I talk to people, I keep finding out about more and more issues that are accruing as a result of this illness.
Yeah, and I think that's the concerning thing. We don't know. I know that the chief medical officer here, Professor Chris Whitty, was talking the other day in a presentation about there being multiple mechanisms for long COVID, and that's why we need that research. And we see trends or patterns of behaviour in the recovery of the children in our group, and we're in quite a unique position because we're looking at 2,600 children, and seeing the posts that their parents put up and hearing the feedback from medical appointments and what they're trying and all of that kind of stuff. And so when we started to notice these trends and patterns, and we then in various meetings talking to different kind of infectious disease doctors or pediatricians, nutritionists, etc. And we have now, it's very clear that there are, certain groups, if you like, people fall into certain groups or categories within their long COVID recovery. And that needs that research to understand it. It's all anecdotal until we get the research, but I don't know. Is it because of blood group? Is it because of genetics? Is it because of behavioral types, lifestyle? Who's to say? But definitely people seem to have clusters or constellations of symptoms.
You said you've been in touch with 2,600 different families of children? Are they all from the UK or scattered throughout the world?
So the majority of the members of our group are in the UK, but we also have Canada, United States, Bulgaria, India, Kenya, where else? Switzerland, Germany, Spain, France, Netherlands, lots of children from the Netherlands. So we do have a wide mix, but predominantly UK.
Okay. Have you found, like, as you've communicated with these people and heard what the children are having to endure, do you notice any sort of difference between the symptoms that adults are getting and the ones that children are getting? If there's any difference there?
Oh yeah, for sure. So
Mm.
pediatric long COVID is very different to adult long COVID, and
Oh,
that's one of the things that we hugely campaign about, because this is one of the problems that we have, is that um, originally they didn't think children would be affected by COVID, so we had to evidence that they were, and trying to break that barrier down was huge. And I believe that we have firmly broken that barrier down now, but now it's kind of trying to encourage and increase awareness and understanding of the differences. And that's really challenging, because in the UK, children were bottom of the priority for testing right up until the end of last summer, early autumn. And then even now, there are many barriers to children accessing testing. One of them being that children don't usually present with the same symptoms as adults, and the questions on the government and the NHS website ask: are you presenting with a fever, a continuous cough, change of or loss of smell or taste? And actually, for children, it's regularly not those symptoms that they present with. So if you don't present with those symptoms, according to the website, you shouldn't be having a test. And there's never been an awareness campaign to help families recognize what COVID looks like in a child. So that's difficult. And if a child doesn't have a PCR test, then they don't get that confirmation that they've got COVID. If they then go on to get long COVID, it's really difficult to get a long COVID diagnosis, and children are often then misdiagnosed. And without a diagnosis, you can't access any of the support services that are currently in the process of being set up. So there are so many issues with a lack of understanding of the difference between the adult version of long COVID and the pediatric version. So yeah, we spend a lot of time raising awareness about that.
so what are some of these specific symptoms that you're seeing more so in the children that you're not seeing at all in the adults?
So it's not to say not at all. It's more some are, but generally
Okay.
it's a case of how they present. So the rashes are huge in children, and not so often reported in adults. They are sometimes reported, but the rashes are really strong. Prevalent symptom in children. Also, lots and lots of the gastric kind of issues. Continual nausea. We've got children that have been nauseous now for over a year, every single day. And although we do hear about that in adults, it doesn't seem to be as prevalent or as continuous. What else happens to children? I think the way that they present. So quite often with the children, they get COVID, they then start to feel better, sort of around week 2 to 3. Then they might have an apparent period of well-being, although they still fatigue easily. Generally, they usually often feel like their energy levels are coming back. They are less symptomatic or not symptomatic at all. And then around week 5 to 6, they then start to develop the long COVID symptoms. And so we've seen that trend quite consistently throughout the time that the group's been running. And more children than not seem to follow that pattern, where they get COVID, then they seem to get better, and then around week 5 to 6, they seem to get the long COVID symptoms, which is interesting, because the pediatric the COVID pediatric complication, which is pediatric inflammatory multisystem syndrome, or I think you call it MISC, the multi-inflammatory syndrome in children. It's the same thing, but I think the UK and the States call it, and America to call it two different things. But that also tends to present not initially. In the initial acute phase of COVID, it tends to present a bit later on. So I'm interested that long COVID seems to do the same thing. And some of the symptoms are similar but less severe in the long COVID. And with the pediatric inflammatory multi-system syndrome, children usually need hospitalization and immediate treatment. So it's almost like, and this is completely anecdotal, but it's almost like long COVID in children is like a watered down version of the PIMS in a way. The symptom sets are very similar. So that's something that we flag whenever we can to the researchers and hopefully encourage them to start thinking about how they can research that.
Do you find that the general population as a whole is starting to take the situation of long COVID a lot more seriously? And just from what I've heard too, generally I've heard it a bit more in the press and in the public, but it's usually focused on adults. And I rarely hear anything outside of, well, your organization that really has much attention on children. Do you see that people are starting to pay a little more attention to long COVID as a whole, and also paying attention to it as children? Because I think the idea is still really that children, have a very low degree of vulnerability, and that is the case when it comes to fatalities. But when it comes to long COVID, like that idea seems to persist, and that just sort of gets brushed aside. Do you see any of that changing at all?
Yes and no. I definitely think long COVID is firmly on the radar now, and that really is accepted. Whereas before it was a huge challenge to try and even get people to believe that you could still be ill months after with these relapsing and remitting symptoms. For children, I think it's still difficult. Lots of children's parents still are taking their children to the primary care teams, GPs, etc., and being told that children don't get long COVID. And so I think there is a barrier in. It's almost like the blinkers are on. They can't make that link between, okay, it's in the adults, it could also happen, it's in adult humans, it could also happen to little humans, which I find bizarre. But there is definitely a barrier there. But there are also a growing number of doctors who completely on board with it, and don't necessarily understand it yet, but believe in it and know that it exists, and know that that children need care. And in fact, in the UK now, we didn't originally have any funding or provisions for long COVID clinics for children, but now there are a growing number of pediatric clinics around the country. It's not always easy to get access to them because you have to be able to get a doctor to diagnose you to get the referral, but they are starting to exist. And that's why, we're working with the NHS on the clinical referral pathway, and we're working to promote the need for education of primary care practitioners, so that we can get past the gatekeepers, if you like, to be able to access the services. So yeah, I mean, there is change, but it's slow, and there's a lot of resistance. It's not economically pleasing for children to get ill from COVID, and I think politically it's not helpful for children to get ill from COVID. I mean, if you're getting children if children are getting ill from a virus which is airborne, and they're not vaccinated, that's really quite challenging, because schools don't currently have any robust mitigation measures. Everybody wants children in school, and children should be in school, for their mental health and for their education. They need to be in school. But if they're getting COVID in school, and then that's potentially giving some of the children long COVID. To make all of those links means that they have to start thinking about how they can reduce transmission in school. They have to recognize that children are getting COVID from school, and then you need funding for ventilation. It just kind of goes back the line. So I very much feel that it's not as simple as just getting people to recognize long COVID in children, but actually there's a much bigger political issue, which is really concerning because, ultimately children are getting sick and not getting better. And we need to resolve that.
Yeah. So have you been trying to communicate with any governments or your government and trying to get them to make the changes accordingly?
Yeah, we've been campaigning since the autumn about the need for a public awareness campaign, child-focused public awareness campaign, so that families know how to recognise COVID, so that they know that they need to test to protect, because lots of families don't get their children tested. If they've got 3 children, they might just get one child tested and then just make an assumption on the rest of them, because the testing process is challenging and not, is a bit stressful for particularly little children. And that then affects the figures of the that are recorded about how many children have COVID infection, and then go on. Obviously, the percentages that are worked out by the Office of National Statistics are based on the amount of children with COVID in the first place. So if people don't get their children tested, that figure is not recorded. And then the decisions in education and healthcare are based on those figures. So there's a sort of a full circle that needs to happen, right back to making sure families are aware of the symptoms of COVID, knowing when and how to get a test. And at the moment, as a parent, you kind of have to rely on the government website, because if your child's got tummy ache and you think it might be COVID, that symptom isn't listed. So what are your options? Either don't get a test or lie and say, well, I've got one of the other symptoms. And, lots of people still are very much have it in their head what we were told back at the beginning of the pandemic, when the tests first came out, which was don't waste tests. Don't get tested unless you need to. That tests are limited, and so we still get emails from families saying, my child is ill, but they don't have the tests that are written on the website. Should I get them tested? And we're always like, well, yes, any symptom of unwell can be COVID in a child. You should definitely get your child tested, because then when we go to meetings and do give presentations, we would then be able to give more accurate figures of actually how many children have been ill, which would help evidence why we need things to change, and for the government to make different changes to help to help reduce, the effect on the pediatric outcome of from the pandemic. So it's so much. When I first got into this, I just thought it was about, letting people know that kids got COVID, and actually that some of them don't get better. But as the time has gone on that we've been campaigning, I've realised, it's a much bigger thing, and we've learnt a lot in the time that we've been campaigning, and it's concerning because I don't know how we get past that.
And with some of these children, like you said, they can't really get the help at the clinic if they don't get that diagnosis. So they have to cross that hurdle. What are you seeing with the families who are in that position where they don't get the diagnosis? What have they been trying to do in the interim?
Nothing. I mean, this is the problem. If you don't get a diagnosis, you don't get heard, and if you don't get heard, then what we're seeing, unfortunately, is that where parents have been or carers have been taking children back to the doctor, with this symptom or that symptom, where it's not seen as long COVID and it's just each symptom is seen individually, what happens is, what we're told happens by the families, is that they feel more and more uncomfortable about returning to the doctor, because they start to feel that they're being labelled as fussy. We've had a lot of articles in the press here about fabricated illness, Munchausen's essentially, and and that makes families really nervous. And so what they're doing instead is not reporting the symptoms, which of course perpetuates the challenge of us trying to raise awareness and to try and get help for the children, because unless people are reporting the symptoms, the numbers of reported symptoms aren't there for them to then say, well, we need to be helping these people because there are more of them. So essentially they do nothing because they're worried about the outcome of continually complaining about something. That's really real. I mean, some families have had child protection intervention
Oh,
where
dear.
the parents are being accused of fabricating the illness, and it's really hard. I can see why some of the families stop engaging, but I'm also concerned that not every symptom will be relating to long COVID, and potentially a child may have had COVID, may have long COVID, but could also have something else going on. And if there's a symptom there that's not being looked at, you could have a really serious health condition being missed in a child because the parent is too frightened to return to their primary care giver because of the lack of trust, the fear of being misbelieved, that symptoms being minimized. So it's a huge, getting that PCR test when the child has COVID is so important, because it just makes that link a little bit easier to getting the diagnosis should long COVID then become an issue for the child.
What in particular could happen there where somebody is worried about their child having long COVID, and they might have child protection come check in on them? Like what's happening there exactly?
Well, I mean, so essentially children can be removed from families if it's felt that the family is contributing to the child's condition and that the condition isn't authentic. So this is something that has happened historically in particular with ME, children with ME. And as we know, long COVID has similarities to ME. And it is not ME. There is a whole lot of symptoms that children with long COVID get that are different to ME, but some children do get more of just the ME symptoms. So again, it's really difficult. And until there's a clinical diagnosis, it's really hard to, it's just hard. It's just hard. Everything is just hard. And there are, depending on your education, your background, your demographics, there are families that are not able to advocate for themselves, are not able to stand up to doctors that are telling them that they've got anxiety, they're being anxious about COVID, the child, they're fussy, they don't feel that they can stand up and speak out for themselves when they're told that, and so they'd rather not get involved in that scenario, so they just simply stop engaging with the medical professionals. And that's really, really concerning, because we're not doctors. We can't tell whether that child's symptom is long COVID or not. All we know is that every symptom needs reporting, because this is such a novel condition. We need to know that we're going to be heard. Families need to know that they're going to be heard, so that doctors can see what's going on. And it's really unhelpful to put families in a position where they're fearful of reporting symptoms for a virus that we don't yet understand. And that's again something that we are raising in the meetings that we attend with the NHS, with the long COVID roundtable, all of these kind of platforms where we get chance to let them know what's going on. Whether we're heard's another thing, but we're doing our best.
Yeah, that's an extensive nightmare where you need some sort of aid with the condition that your children are having, but then you're worried about a type intervention that might occur from you speaking about it that'll just make your life even worse, even though things are already terrible. It's just a nightmare.
It's a complete nightmare because, we are families dealing with sick children, very, very sick children in some cases. And there are no guidelines, there are no handbooks. There is no other situation I can think of in my parenting career where I've not been able to Google, read, make a phone call to get some help or guidance if I've needed it. And, we're navigating this path without any support, and actually worse than that, people are trying to trip us up. And it's extremely difficult, concerning, and and heartbreaking, particularly for the families that perhaps they have clinically vulnerable family members or children. Perhaps they have had social services intervention in the past, and they don't want to get into that scenario. So then the children aren't seeing doctors, and I think that for me the baseline is that children should have as much access to care as adults do. So we need
Mhm.
to change the narrative.
Like you mentioned that things are changing in a positive way. Is there any groups of people or anything of that sort that are really pushing back hard against you, not just with long COVID in children, but in general, saying like it's a complete fabrication and you guys are nuts? Is there any of that going on, or is it just there's got to be some of it, but is it anything beyond just like the odd isolated person with a personality disorder?
Um, there are always, there are the deniers, the COVID deniers that troll us on a daily basis, who think that we are making it up, and that perhaps if we were a bit more positive, or we had a better lifestyle, or we had better nutrition, our children would get better. Um, so in terms of the general population, we come up against that a lot, and that's draining and really quite soul destroying, because we would not wish this scenario on any child, on any family, on any adult. It's just a horrible position to be in. But also, we don't see the support that we would like to see from the Royal College of Paediatric Child Health. We don't see, the professional bodies that we feel should be standing up and fighting our corner. We're not seeing that, and that's really difficult, because we very much feel that we're not going to see so much change at a local level in primary care until those kind of people further up the food chain are actually acknowledging it and talking about it, and until there's a clinical definition for long COVID in children. I think that we are going to continue to struggle to get children diagnosed correctly, and therefore struggle to get them into the services that we have been shouting very loudly are needed. And then it almost perpetuates the belief that there are not enough children to go into these services, because if we can't get them diagnosed, they're not seeing them in the clinics. And then they say, well, we're not seeing many children. Well, no, because we can't get the diagnosis, because we're not getting the support from the people who should really be prioritizing the health of children. And I don't understand why. I don't understand why anyone who's worked with children would want to minimize the symptoms that these children are experiencing and make it harder for us to access to care and support.
Yeah, absolutely. You mentioned that there was the clinics that are starting to pop up in the UK. Is there anything similar you see popping up in other countries? No.
Not that I'm aware of. I know that uh, in the United States there are some hospitals that will diagnose and see children with COVID. It seems to be very different from state to state, and whereas in others areas, they're completely denying that children can even get sick from COVID still. So So I just think it's, I mean, here we would say a postcode lottery, but it's so variable. And actually, even here, I know, for example, right off the top of my head, Greater Manchester set up a service. We've got one in Dorset, but there are lots of pockets around the country where there is nothing, and still, GPs are often saying, well, this doesn't happen to children.
Okay, so there's a lot of places in the UK where there's not really anything.
Yeah, I mean, so there was we got given, well, not me, I wish it was me, but given funding for long COVID clinics. These clinics didn't materialize until very recently, even though the funding has been there for a while, because obviously it took time to set them up, and that, they're called post-COVID service assessment clinics or something like that. And basically, they're collecting data on, and validating symptoms, I guess, listening to what the patient's experience. They ask a load of different questions, and it varies from clinic to clinic what they do, because each clinic sets up their own service. So there's no standardized assessment, which I think is something that really needs to happen. And then of those clinics, a handful, maybe 7, 8, 9, might see children. The majority don't, and that's one thing that we've been talking to the NHS about in depth. And there are issues around where those services can be, so they have to have the right kind of environment. They can't be necessarily with other groups, or there seems to be lots of barriers that are preventing the setting up of services for children. And where there are clinics, the waiting list is already like 9-10 weeks or longer, if you can get a referral in the first place.
Right. Now, I've talked to a couple people on the show with long COVID. One, her lungs seem to be doing better later on now, but everything else is still an issue. And then I talked to somebody else really recently, he still has major lung issues after over a year. How have you guys been feeling?
So that's a good question. So my daughter was 14 when she got it. She had 8 months pretty much consistently in bed, and she was previously a strong ballet dancer, gymnast. And she was crawling from the bed to the toilet. She was having all her food in bed because she didn't have the strength to sit up to eat, and she had no interest in.
She couldn't walk?
No, she couldn't walk. We've got lots of children that are paralyzed. My daughter wasn't paralyzed, but
paralyzed?
Yeah, from the neck down. We've got lots of children in wheelchairs. Yeah.
Oh my goodness.
Yeah. It seems to have a very there's a wide range of symptoms. There are over 100 symptoms of long COVID in children. There's like a cohort that seem to get like the ME/CFS type symptoms. There's a cohort that get the mast cell activation syndrome type symptoms, the really strong histamine response, allergies, hives, food intolerances, that kind of stuff, skin rashes, those kind of things. Then there's a group that, sorry, my own brain fog's kicking in now. Marcel, God, completely gone. I should know this. Fatigue. What's the other one? It'll come back to me. God, that's awful. So sorry.
Ran away on you. That's okay. Oh, we can come back to you.
Yeah. Edit that bit out. So there's we have children who have had nerve pain, loss of use of their legs, incontinence, completely and utterly debilitated. That one of the cases which stands out really clearly in my mind is a boy called Manny, who we have talked about in many of our presentations. So I know his mum won't mind me sharing his story. And he had like sore throat and flu-like symptoms at the beginning. He was in and out of hospital 2 or 3 times with kind of slightly odd symptoms, not quite feeling right, and having the last symptom he had before he then lost the use of his body was breathlessness, and he was sent home with a steroid inhaler. And then he had some pain in his hands and legs, and they said that it was all in his head, and that basically he needed to calm down. And then within 24 hours, he was paralyzed from the neck down, unable to talk. And he was in a wheelchair for nearly 7 months. He can now shuffle around at home, but he can't walk out of the house, and he can't be up for long periods of time. He gets very tired. And he was a captain of his, I think it was rugby, actually, not football, team. So he was very fit and strong before, but now he's, he's disabled, and he has been like that for months. And he still has excruciating nerve pain and many other symptoms. We have numerous children that are in wheelchairs, unable to walk. Some of them have had the peripheral neuropathy, and that's gone away after 3 or 4 months, and they are now back on their feet, but not as able as they were. They're not well, but they have improved. But we also have a cohort of children that have seen no change and are as disabled now as they were when they first got COVID. So my daughter being able to drag herself from the bed to the toilet, which was horrific for us to see, in comparison to those stories, we feel very lucky now, because she is actually back on her feet. She's now going to school. We're at month 13 since she got ill. So she's now going to school for 4 hours a day. She doesn't come home exhausted now. She's able to come home and be out of bed, and put the dishwasher going or do little tasks without experiencing relapse. But we're still pacing her activity, so we make sure her heart rate doesn't go, she doesn't exert herself massively. We've modified her lifestyle, so that we've found this kind of even keel of being able to continue seeing recovery without restricting her so much that she can't do anything, but we don't let her do everything that she would like to do just yet. We are quietly confident that she seems to have turned a corner now. Literally just in the last 6 weeks, I feel like I can say that out loud, but I don't want to get too excited just yet, because it's been so horrific, that, and I've seen children in the group with their parents posting, recovery story. We've had 4 weeks, no symptoms, or, and then their child's crashed and had worse relapses than they've ever had before. So the longest gap I've seen is about just under 6 months between no symptom and then them posting recovery, and then them coming back on and saying, no, we've had another relapse and we've been hospitalized, or we've now got new symptoms, or we're back where we were. So it's really hard to know what better looks like, or when better is, if that makes sense.
Oh, well, absolutely, because this is completely new. And so, people don't know the timelines. And you brought up one thing that I was also have been worried about with long COVID is new symptoms. Have you talked with any people where, they'll have, XYZ symptoms over the course of whatever, 5 months, 10 months, and then boom, at, whatever point recently, like something, comes out of the woodwork that they haven't seen before?
Yeah, so I think it's really important to mention that children can be asymptomatic, symptomatic, or atypical in their presentation with COVID. And we regularly get families that maybe have multiple children who have had COVID report that say 2 children were symptomatic and 1 was asymptomatic, for example. And so they think that the asymptomatic child has kind of got away with it. And then 6, 8 weeks down the line, they realize that their children have long COVID, and the asymptomatic child still seems to be fine. This is just an example. It's not always asymptomatic child, but just as an example. And this particular family that I'm thinking of, they got to nearly 6 months after in COVID infection, and the asymptomatic child then started developing COVID toe and had really severe COVID toe, so that they couldn't actually walk. They had to crawl around on their hands and knees, and their feet were so swollen, purple, split skin, peeling skin from the soles of their feet, that they couldn't put their shoes on. So it's really interesting, I think, that it doesn't matter which version of COVID you get in terms of severe, mild, asymptomatic, atypical, symptomatic. You can still get long COVID, and your symptoms can come on at any time. So far, anyway, seems to be that they can come on any time after your infection. So the longest that I know for sure we've had reported in group is 8 months after infection that they started seeing symptoms, and they thought that they didn't have long COVID. In this particular child. And so obviously there's no way to be sure, were they reinfected at any other point, or, could it be a new infection? But the family were adamant that they had been living in a bubble for fear of reinfection, and because of lockdowns, and school wasn't happening at this time, etc. So they didn't feel that there was any chance that the child could have been reinfected. And we have seen a pattern between months 9 and 12 after infection, so 9 to 12 months after infection, we've seen a pattern of children developing COVID toe. So it's almost like they may not have had it at all at any other point, and then there seems to be this wave at that point, and I don't know why. It was just something that we suddenly got loads of people on the group reporting, oh, we've suddenly got COVID toe. So that's interesting. And, how do we know if it's from the original infection, if it's a secondary infection? If children are often asymptomatic and couldn't access testing, it's really hard to know. But it happens. It happens all the time that families are reporting new symptoms that they've never had at any other point, and then they're developing them. And I know for myself, I had the worst breathlessness and the most scary relapse in January, which was 10-11 months after I got infected. So I'd never had those levels of breathing problems up until that point.
It's terrible. But I'm glad to hear that your daughter's doing better. And I think it's time I got to let you go. So thank you so much for the work you're doing. I think it's very important. And can you, is there anything else that you'd like to tell the audience to keep in mind, or anything that you think people should be doing at this point in time?
I'd just really like to say that, if you can avoid COVID, you can avoid long COVID. And that is the only way for sure that that you won't get long COVID. Anybody of any age can get long COVID. And so remember that coronavirus is spread via aerosol transmission, and that if you're in an indoor space, distance alone isn't enough. There needs to be robust mitigation measures. So, air quality is really important. Ventilation is really important. So reducing the time that you're in an indoor environment with other people is key. And if you do have to be in an indoor environment, wear a mask.
Awesome. Where can people keep tabs on you?
Our website is longcovidkids.org. We're on Instagram, on Twitter, and on Facebook. So please do share, tweet, comment. We run on goodwill. We're all volunteers. We don't get any funding unless people very kindly decide to donate, which is always very helpful, because there are costs to running the campaign. But that's not why we do this. We do this because it's necessary. And if people can help with organic reach just by sharing the work that we do, that's really, really fantastic.
Awesome. Well, donate something, people. And also, as to those comments, make sure they're nice comments.
Yeah, thank you.
Awesome. Thanks, Sammie. Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. find them at jefflap.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor, Jeff, at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information, shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at NCovid19. You can find me on Twitter at Mr. Farden. It's at MrFarden. Till next time.